we've taken a position so far, and the candidates have, through the process, a few have not, on basically Medicare for all, which is we're going to eliminate 150 million people's health care, and we're going to provide health care for people that just come over the border. That is an untenable position for the general election. This is reckless as it relates to, and you don't have to take the position to win the primary, and you're basically literally hindering yourself for the general election.
Okay, so he says you don't have to take the position to win the primary, but that's the position a lot of them are taking in the primary.
Gosh, you know, me agreeing with Rahm Emanuel, this is one of those, you may have to get the YouTube of this and broadcast this everywhere, but to the Democrats who watch the show, listen to Rahm Emanuel. He is absolutely right. Guys, Ainsley, there's only two ways to allocate scarce resources, right? All resources are scarce. The very bedrock of economics is the allocation of scarce resources. A doctor's time and hospital beds are scarce resources. You can either price them or you can ration them. When you wipe out the price signal, which is what government-run healthcare does, it wipes the price signal out. What do you have? You have number two, which is rationing. That's the only way. It is axiomatic. It is absolutely tautological. What I told you, there's no, you will win the Nobel Prize in economics from this point on every single year. If anyone in the listening audience can tell me a third way to allocate scarce resources like a doctor's time and hospital beds, there isn't one. You will get rationing like you have in the United Kingdom and other single-payer healthcare systems now. The problem you'll have, too, as well, is they've had those systems for so long over there. A lot of the people alive don't know any different. The people in the United States do. If you rip that away from them, their free market healthcare now and their choices, and you instill a rationing system, Rahm Emanuel is right. It will be economic and political suicide for the Democrat Party.
So remember, the last time they had a debate, they weren't targeting Trump as much as they were President Obama. And he was a former chief of staff. So they say Medicare for all is a death sentence. He says he traveled around and he talked to people. They said, why are Democrats going to take my health care away? Right now, they say the polls show the Democrats have a 36% advantage over Republicans when it comes to health care. So there's an opportunity, there's a gap there the Republicans got to fill, and the Democrats are rushing to help them fill it.
Yeah, well, Brian, this is because the media is not telling the truth about what Medicare for all and the Democrats' health care plans really are. If the media were to actually do their job and tell people, you understand, right, that Medicare for all means the Medicare you have now, it really means Medicare for none, because the Medicare you have now is done and over. That's finished. Also, those unions, Brian, imagine the unions, the local 3 guys, the steam fitters, the tin knockers, the carpenters, the truckers, who for years negotiated they forfeited wages, right? And then they to get these health care plans, imagine them finding out that it's all gone. That's all gone now. You're going to get on a government-run plan. Yeah, good luck with that.
Good luck getting the union vote. Thanks, Dan.
They've got